Welcome to the Cyber Business Podcast, where we feature top founders and entrepreneurs and share their inspiring stories. Now, let's get started with the show.
Matthew Connor here, host of the Cyber Business Podcast. Today we're joined by Jimi Michel, CIO at Island Healthcare. Jimmy, welcome to the show.
Thanks so much for having me. Great to be here.
Thanks for coming on. Before we get too far in, a quick word from our sponsors. This episode is brought to you by cyberlinks.com. That's cyberlynx.com. Do you know if a hacker's in your system? Most people and most companies don't until it's too late and the hacker's already done damage. A hacker's job is to bypass your security, so companies need a way of knowing when someone's gotten past theirs. That's where Cyberlinks comes in. We partner with the best cybersecurity companies in the world to be able to provide our clients with the best solutions at the best prices. So whether it's managed SIM, SOC, EDR, MDR, XDR, you name it, we'll help you find the best solution at the best price. Find out more at cyberlinks.com. That's cyberlynx.com. And now back to our show. Jimmy, for those who aren't familiar, can you tell us about Island Healthcare and your role there as CIO?
Sure. So Island Healthcare is a health center on Martha's Vineyard. It was founded in 2004, and it was actually the first rural health clinic in Massachusetts. About 9 years later, in 2013, they received the federally qualified healthcare facility designation. So we are an official FQHC. And the goal has really always been to provide access to high quality, affordable health care to the people of Martha's Vineyard. And as you can imagine, it started out pretty small. Today, we have just over 60 employees. And that spans primary care, behavioral health, chronic disease management, and then as of last December, dental. So we just opened up a dental clinic, which super exciting. I joined IHC last fall in October, so just about a year ago in October. And I lead a very small team that includes a network security lead, an electronic health record lead, and then a few other folks who platoon in IT. You know, we're a mature organization. We've been around for over 20 years now, but it also kind of feels like a startup. You know, everybody's wearing 5 or 6 different hats. So, you know, I'm not ashamed to say that, when I'm on site, I'm here in Portland, Maine, so I work remotely, but when I'm on site, the first couple of times I was looking around to see, who are those folks that if they're not in IT, they're really comfortable with technology. Everybody there's super helpful and kind of willing to platoon. So, I'm on the lookout for, all right, who's my kind of unofficial help desk backstop. And so, we have a small group of kind of official IT folks, and then kind of a much larger team of folks who, one of their 6 different hats is just kind of helping out with a webcam or a Zoom issue when needed. And then as far as day to day, as you can imagine, my work spans the gamut. It's one of my favorite things about the job. Most of the time, it's one of my favorite things about the job. In any given day, I'll spend time with a colleague just fixing a webcam issue, or helping them through a Windows update. But when I'm not doing that, it's reviewing audit logs, meeting with a vendor, daydreaming about AI, and kind of like long-term strategy. My boss will probably listen to this. I report into the COO, who's fantastic. The daydreaming part is very important, but a tiny percentage. Usually before I clock in while I'm walking the dog. But certainly now more than ever, that's, it's important to also think about the big picture. So, it's a very hands-on role, which is one of, something I'm really thankful for.
Yeah, I love it. I gotta think that, I don't think it's really kind of daydreaming or a misappropriation of time when we're talking about IT or AI, because I really think that is the future, and I think that it's not a bold statement that anybody would really disagree with. So I think that I think it's really interesting where we are with AI and kind of where we're going. And I think every CIO needs to be thinking about, what that means for their organization. It's our job to help steward and guide the organization when it comes to, technology and helping them, make the right strategic decisions and the right financial decisions when it comes to this. And so a lot of money can be wasted with missteps. And so there needs to be a lot of good thought put into, an AI or technology, expenditure and plan. So I think you're spot on with the thinking about it. And I'm curious, kind of where you guys currently are with AI and where you see it going in terms of what you're going to do at Island Healthcare with AI, how it can really help you guys.
Yeah, I think, I mean, I agree with everything you just said. I think the thing that really resonates with me about what you just said was just the kind of part about being really thoughtful. And I've worked in digital health for just over 15 years now. So I got my start in the midst of Aura and high tech. So I was working as a software developer at Meditech. And that was kind of my introduction. And we were in the midst of a huge sea change at that point. The government had incentivized the adoption of digital health or digitization of health records, so electronic health records. And so I think a lot about the differences between the kind of 2009, 2010, when we were rushing to implement EHRs, kind of that paper to digital transition, and now, and there are a lot of things that I think there are a lot of similarities and parallels, and then a lot of things that are different. One thing I think about, you know, back from 2010 was that, um, and it's certainly not specific to any, uh, any vendor or specific EHR, but I remember back in those days across the board, a lot of the purchasing decisions were really led by CFOs. There was a huge financial incentive to do this digital transformation, to go from paper to digital health records. Um, and so the market, I think, really aligned to the needs of the financial needs and the incentives that were there and that were driving some of these purchasing decisions, and rightfully so. As businesses, that was the smart kind of business decision. But we also, I think, looking back 15 years later, um, you know, we didn't have a lot of nurses or physician assistants or or people, end users on the floor, the people actually delivering care to patients, weren't in those rooms kind of providing feedback uh, and contributing to those decisions. Um, and I think we've gotten through that. It's there are still kind of usability challenges with an electronic health record, any electronic health record. But we've gotten through that. Um, and kind of without kind of providing any more opinion or comment on that, I do think that with AI, it's a little bit of, well, I shouldn't say a little, I shouldn't minimize it. It's uh, a very, very different environment and very, very different priorities and kind of things that we need to be thinking about as we go through another kind of sea change or digital, industry-wide digital transformation in 2025. Usability is more than just whether your staff like using a piece of technology, which is also important. But it takes on an increased importance, um, when you kind of consider that within the context of AI. So 15 years ago, if you couldn't, if a piece of software is difficult to use or you didn't use it in the wrong way or in the right way, you may have just kind of ended up at a dead end and had to call for help. That's not ideal, but that I don't lose sleep over that. Or I lose a lot less sleep over that. With AI, the challenge with AI is that you often don't know if it's working correctly or not. And I'm focusing on user-facing AI and leaving out kind of the back-end analytics and data science part of it. But speaking just to the front end part of it, um, I think that you really have to partner with your users. You have to have them in the room informing your decisions, because they are make or break, in a way that uh, I don't think really was in play the last time we did this kind of wholesale digital transformation.
Yeah. No, absolutely. And I mean, I think beyond just the kind of the hallucinations, you also have the data security and privacy issues, right? And I think that's a real challenge that everybody needs to, consider when implementing it. So how's that work for you guys? So I guess currently, what is your current, use of AI? Is there anything that you're doing that where you found, hey, this is working great for us. This is fantastic. Or you know what, we're taking, or are you taking more of a conservative approach and not jumping into the waters just yet?
Yeah, so I think we've dipped a toe in. Um, I think, going back, I'm fixated on the word thoughtful here. I don't know why. But I think that it's important to know when you're making important decisions, and these are among the most important decisions, what tools to use, especially in a clinical environment. Um, to really be thoughtful and clear about your priorities. So you hit on something that resonates with me. Um, we sat down and really thought about what our priorities were when it comes to AI, and it turns out that they're really the same priorities that guide all of our decision making. So the first priority is safety and security. Our patients place an enormous amount of trust in us when they come to us for care. They trust us to deliver high quality care. And then they trust us to protect some of the most sensitive data imaginable. So we have, and this will never change. Whenever we make a decision, it's leading with a kind of negative, but if we aren't fully confident that a decision will maintain the privacy and security of our patient data, and also, you know, not in any way negatively impact the quality of care. Those are the two things that we look at as just kind of table stakes. So that's and if we have any doubts on that, it's the end of the conversation. So we that framework really applies to all of our decision making, but think about IT procurement, deciding what we allow into our business and into clinical care. Um, we've had to over the last year really rethink our um, IT evaluation and procurement processes specifically for AI. I could talk for hours on this, and I'll try not to. But adversarial testing has taken on just an infinitely more prominent role in kind of our evaluation. So we all know, some vendors will come in, and good vendors, vendors that have a high quality product will, uh, you know, come in, do a demo. Everyone is super impressed. Um, and we've always done kind of the due diligence afterwards. What are the kind of data dependencies? What does change management look like? All of those things. But and there was a certain amount of adversarial testing. I'm not talking specifically about Island Health, but healthcare, but just in general. There's always been a certain amount of adversarial testing. Just make sure that it, put in an out of bounds value and make sure that it throws an error. With AI, it really takes on. I mean, that's just a much bigger percentage of the work we do to make sure that something is safe. with an AI tool as compared to kind of a more traditional tool. So safety and security first, and then kind of right underneath that, business continuity and kind of operational continuity. So I mentioned a little bit before, but change management. Um, you know, AI tools. I mean, I'm fighting the temptation to lecture here, but
Go for it.
um, I'll brag a tiny bit that I worked for an AI startup before November of 2023.
Hmm.
Um, and when ChatGPT came out, and I feel like I repeat several times, maybe a week, that AI actually did exist before ChatGPT.
Hmm.
ChatGPT packaged AI into a medium that everyone could access. It was, you could just talk to it. It wasn't kind of that paradigm shift from an interaction standpoint. In healthcare, it is a paradigm shift. Clinicians, we have clinicians who some of them are like, yeah, give me those, AI chatbots that are trained on the New England Journal of Medicine, so I can, get, up-to-date clinical guidance. And there are others who are just not comfortable texting or having a text conversation with a robot. Um, and so, from an operational standpoint, some of these tools are great, and they have obvious potential. Some of them are really safe. I think of Open Evidence, which is a natural language chatbot that is trained, I think, on New England Journal of Medicine and other kind of really high quality academic journals. But it's ChatGPT or the ChatGPT interface, but with very kind of tightly controlled. We've done some testing. We feel that it's generally safe. Um, but it's a paradigm shift that I don't think in fact, I know that all of our clinicians are not comfortable with yet. And so to put it in their hands when they're not comfortable with it, um, first of all, makes them less effective. Um, you know, increases the risk of error, not because of the technology's fault, but because, and it's certainly not the user's fault because they don't have the experience or the kind of comfort with it. So making sure that AI is delivered in a way that makes sense, I think is really important to that kind of second bucket of operational continuity. Um, Compliance is a huge thing. We're in kind of the wild, wild west as far as regulatory compliance. Um, so we generally take a much, much more conservative view of kind of what should and can be done. Um, but making sure that our use of an AI tool isn't uh, doesn't run afoul of regulatory compliance or payer compliance. So we work with insurance companies, we bill Medicare, Medicaid, and they have requirements and they're beginning to have some AI guidance. So that's kind of a high but long-winded overview of the approach, and then quickly to your actual question about where we are. Um, we are, I think, pretty conservative in our implementation of AI right now. We have limited use of what I would call AI job aids. And so that's things like open evidence where a clinician can ask a question in natural language uh, to an LLM that's been trained on trusted information. Um, we have some staff, we enabled Copilots or a Microsoft shop. We have Copilot, which is kind of within our system. So some folks are using that for the things that you use an LLM for to help write emails, kind of those day-to-day job things. I think in the near future, I'd love to, um, kind of increase the folks who are using those tools and do some training for them. So, if you think of the crawl, walk, run breakdown, we're crawling with job aids, and I think Yeah, and I think that's it's going well, slow but well. In the near future, if you think of walking, um, I'm hopeful that in the near future we are able to use AI to increase our operational efficiency. So you think of scheduling, fixed asset management, and not things that users are interacting with day to day, but kind of behind the scenes, trend analysis, those things. Um, I think there's an enormous potential in the near future for us to benefit there. We are federally funded. We also have private donations, so there's an enormous amount of responsibility on our part to make sure that every dollar goes as far as it can. And if we can find a way to kind of safely stretch those dollars farther with AI, I'm all for it. So that's something that we're excited about. And then I think finally in the distant future, and I think I'd probably get into an argument uh, with a lot of folks, and I'm willing to kind of die on this hill. I think in the distant future, the kind of run column of crawl, walk, run, I think we know what the future of agentic AI is. I mean, the vision is very clear. You know, we have folks who spend their day doing scheduling, intake, those sorts of things. Um, they're wonderful, talented colleagues, and we could certainly have them do higher level stuff. We have, we're on an island. We need in-person people. We struggle to hire. So for us, AI is never going to replace people, but the ability for an agentic AI agent to take over some of the kind of more routine communication and processes would be an enormous benefit for us. But personally, I don't think we're here. I don't feel comfortable actually giving the agency to a chatbot to be able to perform those tasks. So yeah.
Yeah, I think I'm right there with you, and I think the early adopters, in this kind of wild, wild west, if to use that again, of AI, I think it's clearly, I'd say, on the reckless side of things, right? To At this point, when you can't definitively and comfortably trust that there are no hallucinations, that it will act properly. You've got it, we're just not there yet. And to put your faith in some agentic AI and say, you know what, go ahead. Here's access to the medical records. Here's access to all the people, all the records, all the information. Go ahead and handle all the scheduling and make the calls, do the stuff, run the shop. That's just crazy, right? And I'm all for technology, but that is that is a step too far. There's not there shouldn't be, and nobody should have the confidence in AI at this point to be comfortable doing that. That's just nuts. And so I'm right there with you, and I think the future being like that, is one of those, a great example of how I think you're, as a you said you're on an island and hiring people is difficult. So it's a perfect place for AI to be able to supercharge people, to make them more capable and more productive without being stressed out, right? I think that's the key. I think a lot of times people hear more productive and they think, how could I possibly be busier? That Okay, it's not. You rewind back to the years where you would have to be farming, or you're out there making the food, or hunting, gathering. That's a busy, tough day, right? We've come a long way, and now, honestly, as a society, it's incredible. I'm blown away. It was funny, just driving the other day, I was like, this is insane. The way we live now as humans, it's insane. The car is driving us. We've got these phones. People, it's the middle of the day. People are just walking around shopping. Insane luxury. This is just, yeah, right. And AI is going to make it so much better, right? To where you're going to be able to get your job done, supervising the AI, making sure things are running. But I don't think that the level of productivity, or being productive in the future, I don't think that's going to look like what people think it looks like. I don't think we're going to the Wall-E state where everybody's sitting around, on these recliners getting fat and have nothing to do. But I also don't think that I think all the tough, you know, knocking out if you want to call knocking out a PowerPoint presentation tough, I think that creative, like putting it together, I think that's going to be so much nicer when that's just done. The mundane tasks are done, and you can just kind of supervise things and make sure everything's running better. I think everybody's going to live even better. So I don't know. I think you're in a really nice spot to be a kind of a test case and a great example of that's where AI really comes in. So I'm kind of curious, how you see that playing out. And it may be just too early right now, right? I mean, it may be too early to kind of look into the future, into your crystal ball and say, hey, in a perfect world, this is what island health would look like in 5, 10 years in the AI world of the future. That's my question for you. In the AI world of the future, however many years, AI is just killing it, right? What does what does island health look like then?
Oh boy, that's that's not a gotcha question, but I feel
Mhm.
like wow. I hope it doesn't look like Wall-E.
Right?
Um, I think we're certainly limited just by the number of people on the island who we can hire. And Island has grown an enormous amount over the last few years. Um, so I don't know how many, I don't know if our head count is the trajectory of our head count can kind of keep up with the growth of the organization.
Right.
Um, and so, I think back to your point about, I'm already busy. How can I be more productive? We have just an enormously dedicated staff. I mean, my colleagues will do whatever it takes to get the job done because they're the ones who are in person are members of the community. So when I go in and sit at the front desk, they see their neighbors coming in, um, and so there's enormous buy-in. But it also having a job that you deeply care about and really love is a double-edged sword because you can burn yourself out. And I'm not talking just about island health. There's an enormous amount of literature around physician burnout. The challenges of having to document, to meet the documentation requirements of payers. There's an enormous amount of work that adds to the stress and prevents people from focusing on kind of higher level work. So my hope is that we have the staff that we have now, and that folks are able to kind of tune out. When 5 o'clock hits, the bell rings and they slide down in the back of the dinosaur into their
That's
car
right.
and go home, and they don't have to worry about spending an hour charting at home. They don't have to worry that they've got claims piling up. So I think in a lot of ways, I hope that we can better execute the status quo that we have now, if that makes sense.
Yep. No, it totally makes sense. And for those younger viewers who are not familiar with the Flintstones, that is what's sliding down the dino. It's a Flintstones reference. And for those who don't know what the Flintstones are, just you'll Google it. So no, I love that. I think yeah, when it comes to healthcare, I think you're spot on in terms of how AI is really going to help make, reduce that sort of burnout. And I think ultimately, in that AI future, when you've got the AI that you can confidently have instead of the doctor, the physician, the healthcare provider having to note things down in the healthcare records and having to take the time to make sure that's done, and everybody else, working on the billing codes and making sure that that everything was documented properly and submitted properly and following up and calling in to get authorizations. When all of that is fully automated due to AI, when the physician walks in and they've got their device, whatever it is, they can see everything on the healthcare records, but it's actively listening to the conversation securely. Yep, notes everything down. The physician can spend the time just with in that interaction, providing care. Boom, healthcare's up, records are updated, it's handled properly, billing is sent off, boom, 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 done. I mean, how amazing. Then you just need maybe there's a human there for supervising the billing, making sure everything is taken care of, but they're certainly not in the trenches like they are now, going through the pains of making sure the codes are right and the documentation's there and that it got authorized and all the crap that goes into making sure the money flows. But for all that to happen just seamless, I think that's the dream. And I,
Yeah. And I think, you mentioned a couple of things there, and I joke that, a big part of my job is just worrying. I think any CIO, it's if you're not worried about, you know, you know, everything, you're not completely doing your job.
that's
Um,
right.
so I go to worst case scenarios a lot. Um, and the two examples you gave there, the billing and then the AI scribe. Um, when I talked about our priorities, the top priority is always patient safety and security and delivering the best care, and then underneath that is the operational side of it. And I think those speak to both of those priorities. I do think we're farther ahead on the AI scribe, I think now. There are some products out there that that are have gotten, really good reviews. The technology is kind of is developed in a way that is generally pretty accurate. You have to review it, obviously. So I think we're close to that. But going back to the conversation, or kind of my comment to a few minutes ago, about who's in the room to make decisions and who are the stakeholders. Um, I had one of my healthcare providers that I've seen for several years, a couple of months ago, very sheepishly asked in one of my appointments, "Is it okay if I use an AI scribe for this encounter?" And they were sheepish about it because they knew that they were going to get follow-up questions for me, and I wasn't, and they were going to like run behind schedule and all of that. What are you using? How do you like it? But so I'm also someone who, I missed a call from a friend the other night, and I called them back and said, "Hey, I'm so sorry. I installed a public beta on my smart doorknob and had to wipe it and redo it, and I just missed the call." Like that's who I am, just as a person. Um, that's not who I am at work. But it's really important to remember that, for my doctor, who knew what my response would be, I'm going to guess that they've had some really difficult conversations with patients about what it means to let a robot listen into a very, very sensitive conversation. And I'm 100% comfortable with it, but I'm going to guess that most of our patients aren't. And think about behavioral health. A lot of people have stigma when it comes to talking about their mental health. It's a difficult thing for those who kind of aren't used to seeing a therapist or a psychiatrist. But those folks are also folks who would really, really benefit from having a note taker. Um, but they're not, you know, the technology may be secure. It may pass all of my adversarial testing. It may be fantastic technology. But, so we may be there on the technology, but if that adds to the stigma of that patient, and when a doctor or a physician asks you to do something, yeah, of course you can say no, but you're trusting this person, so you're kind of inclined to say, okay, but maybe you're not as open about what's going on, and that leads to, not bringing up an important topic in a clinical interaction that could affect patient safety. And so it's not just the technology, um, and it's 15 years ago it was the CFOs. Now it's the CFO, hopefully the CIO, the people who are using the technology, but then also the patients. And you have to figure out, not only you evaluating more things to a greater depth, but you're getting kind of a sign off, or you're including the perspectives of more people than you ever were before.
Yeah. It's interesting because I sit in this position where I remember my grandmother who now she'd be about 100 years old or so. She used to believe that the government was spying on us through the TVs, right? Back in the day when TVs, were that was the modern technology of the day, and now. And I'm, of course, I extrapolate that, and I assume that everybody in the, kind of the greatest generation and older, were similarly minded, right? They were kind of fearful. They were very protective of their privacy and their rights, and they didn't want the government or anybody else, interfering with those. And then you get kids today on the other end of the spectrum where kids now are like, I don't care if Google and Microsoft and everybody have all my information. I've got nothing to hide. I don't care. And they have less, I think as a general rule, there's a large amount of people who, coming up who have less concern for personal, data privacy, which I think is also really interesting. And so I think if that's true, and I don't know, like I said, that just happens to be, I extrapolate that for all the old people, I extrapolate that for all the young people, could be completely wrong. But if that is generally true, then I think it builds for a case because they grew up with technology and they never saw it bite them or hurt them, and they were so young that it didn't matter if their identity got stolen or they were getting weird emails and texts and phone calls. Didn't matter to them. Um, but I think that kind of, do you think that sets up the future for, people to be far more accepting of that AI scribe and the AI doctor, the AI technology, to where it's like, I don't care if they hear my therapy, because you know what? They understand the vastness, or they think that there's this vast wealth of information out there. Their information isn't important. So in the huge sea of data, their information is not going to stand out. And what does anybody care? So do you think that's going to be the prevailing thought among the younger generations as this, becomes more ubiquitous? Or I extrapolate a little too much, a little misguided.
Yeah, it's a really great question. I mean, I've got a couple of thoughts. I mean, one, um, I think in general, I was talking to an English teacher, high school English teacher the other day, and she was saying that she's just starting to get students who kind of began to write when right at the time that ChatGPT came out.
Oh.
And I won't say her name or where she teaches, but it's um, to put it bluntly, it's a challenge because they're so native, it's so comfortable that they actually didn't learn the critical thinking skills and the kind of formative skill set before. I mean, I think in a lot of ways is a magnifier,
Mm.
and it can magnify really interesting thoughts, but it can also be garbage in, garbage out. And so I think I think generally younger people are more accepting of new technology. Um, but it's a double-edged sword. for sure, because if they don't get the kind of formative skills, I mean, I'll admit on a podcast that's going to go out to a lot of people, I'm not a great, software engineer or data scientist. I know how to write, I know SQL, I know SAS, but it takes me forever. AI has revolutionized and made me infinitely more efficient because I can send in my junky code and it tells me all the things that are wrong with it. But I wouldn't be able to do that if I didn't know how to do it in the first place, even if I wasn't very good at it. So I do think that, I think that we're certainly going to get more acceptance, but at what cost? The I'll follow that up though, by saying that I'm not sure I agree with you 100% on resistance from older folks. I think that ChatGPT, again, November 23, was 22. Is it 22 or
I'm not sure at
uh,
this point.
I guess it was
Yeah,
22.
22, I think.
All
Yeah.
right. You don't have
Yeah.
to. Yeah.
Oh, good.
We
Yeah.
don't have to Google it, but I think it was November of 2022. Um, you know, AI goes back 50 or 75 years, before that, the study of it. Um, and I'll give a quick shout out to a former employer. I used to work at UC Davis Health, and one of our big projects was healthy aging. It was a healthy aging in a digital world. Amazing, amazing work helping people remain independent, um, and live, have a kind of higher quality of life, staying in their homes as they aged. One of the big things we looked at was social isolation and loneliness. And this is in 2017, 2018. So before ChatGPT, before COVID. Um, and there was an enormous amount of promising research around voice assistants to help people, essentially address social isolation and loneliness.
Yeah.
Whether it was kind of purpose fit hardware and software, or just an Amazon Echo. Um, and some of that trust is eroded with ChatGPT and the kind of everything around it. But I wouldn't completely give up on that.
Yeah, no, I totally agree. I think it's really interesting when you see some of the senior citizens, how well some of them really adopt technology, how much they like it. I mean, going going back to the self-driving cars, there's a great example of allowing people who may be challenged to drive themselves continue to get around and be independent because the car does 95% of the work, and soon it'll be doing 100% of the work. And great, now you don't have to worry, well, I can't get to the store anymore. No, you sure can. Just hop in the car, it drives you there, you're golden. Now you're at the store. So no, that I think there's a lot of great examples like that. Well, you know what? This has been, Jimmy, this has been an absolute blast. And I think we can go on for hours and hours, and I'd actually love to because there's so much here. I'd love to talk about the effect of this technology on the younger generation. We started to dive into it, but we just don't have time. So maybe another episode. Jimmy, thanks so much for coming on. But before we go, can you tell everybody where they can find out more about you and more about Island Healthcare?
Sure. Island Health is ihimv.org. And I'm on LinkedIn. I'm an open networker, and love kind of helping out early career folks. So, reach out if I can be of help, and always happy to chat. But this has been wonderful. Thank you for having me.
It was a pleasure. Thanks, Jimmy. Till next time.
All right, have a good one.
Thanks for listening to the Cyber Business Podcast. We'll see you again next time, and be sure to click subscribe to get future episodes.